Over 5 million Canadians suffer with irritable bowel syndrome, otherwise known as IBS. It's the #1 reason that a patient will visit a gastroenterologist. Dr. Nigel Plummer, an expert in the field of probiotics and research, who has published over 100 papers on probiotics and has dedicated his life to the research of probiotics. Dr. Plummer, can you help us understand what is the use of probiotics with something like irritable bowel syndrome?
Well, first of all, let's actually start off by saying we don't know what actually causes irritable bowel syndrome, but what we do think is that increasingly that the disturbance of the microbiome may be an important part of the onset and progression of irritable bowel syndrome. So if that's the case, then probiotics as a way of, if you like, putting back the right balance to the microflora may have an impact in terms of being beneficial in IBS patients. And to actually show this, there's been a number of trials that have been done, and one of the trials we actually did showed this to great effect. What we had in this trial was patients, it was a double-blind placebo-controlled trial. We had patients divided up into those who were taking the probiotic and those who weren't. And what we then measure is what we call total IBS symptoms. And this is comprised of level of pain, intensity of pain, bloating, satisfaction with bowel habit, and quality of life. So you bundle all of these up in what we call total IBS symptoms. And in this trial that we did, what we found, we had a significant decrease in all of those symptoms. So pain, duration of pain, bloating, satisfaction with bowel habit, and an improvement in quality of life. And this is the product that we used in this, HMF IBS Relief. And because of this trial, Health Canada have given us the right to use this as a claim or as a title for the product. So, and what this is showing is that probiotics and other trials are showing similar effects, that probiotics are one of the major areas now where the medical sector are looking as a treatment for irritable bowel syndrome.
Well, this is huge, considering a trial that is a gold standard, a randomized clinical trial like you're describing. Can you tell us a little bit about the therapeutic dosing in a trial like that?
Yes, we used a dose in here, and dosing is often difficult to try and get that right, but we used a dose of 25 billion CFUs, colony-forming units, every day for 8 weeks. So and within that time, what we showed was that in terms of the placebo group compared to the probiotic group, we've got a divergence in terms of clinical symptoms within 2 weeks. So within 2 weeks, we could see differences between the probiotic group and the placebo group. By the time we got to 6 weeks, it was a significant difference, and the time we got to 8 weeks, it was even greater. What was also important from this trial was that when we took the probiotics away after eight weeks, then the symptoms started to come back. So it indicates that we probably need to keep the pressure of giving the probiotic on for a considerable period of time to maintain that symptomatic benefit.
I think that's a really important point. So taking probiotics and probiotics such as the HMF IBS Relief are in a supplement form. Could we get that same effect from using food?
No, I think that, again, coming back to the foods as probiotics is a broad category, varying from, let's say, sauerkraut and yogurt to, if you like, with the more functional probiotic foods. So some of the functional probiotic foods, if they have also shown clinical benefits, they can be used. But typically you won't see the same effects by just using, if you like, an everyday probiotic food or probiotic type food such as sauerkraut or yogurt.
Right. So how would somebody who wants to take HMF IBS Relief, because you commented on the symptom improvement, how do they take this? Is there special recommendations on how to take it?
Easy, really. The only thing is that, and the sort of golden rule is that probiotics should always be taken with food. So you have to take it with food, which is either just before a meal, or with a meal, or within 30 minutes of actually eating a meal. And the reason for that is that the empty stomach is very acidic, and that has a detrimental effect on the viability of the probiotic organisms.
And not all probiotics may be alike. Can you help us understand how something like the Genestra IBS Relief probiotic is different from other ones on the market?
Well, I think, yeah, I mean, there's a whole host of probiotics available now, and in terms of how do you choose a good probiotic product from another, well, again, the golden rule is look for products that have clinical evidence to support the use of that product for the condition that you're looking to actually treat. And so in this case, HMF IBS Relief has been shown in both clinical trials and by dint of Health Canada giving it this claim to be effective.
Right. So when looking for a good quality probiotic that has been clinically researched with therapeutic dosing for IBS relief, ask your healthcare provider, your pharmacist, or visit your specialized health food store, or visit Soroil.com for more information.